Hello, my name is Madison. I'm your student nurse today. Can you tell me your name and date of birth?
Lulu Penelope Smith the second. I was born 8/16 of 72.
Okay. Do you have any allergies?
I'm allergic to amoxicillin, penicillin, Vicodin. I'm allergic to Tylenol PM, which includes Tylenol, and it's the same thing as acetaminophen. I'm allergic to peanuts, tree nuts, and I cannot eat avocados.
Okay. I'm checking your wristband and that all looks correct. I'm performing hand hygiene and I'm providing for privacy. I will wear gloves when appropriate. Your provider ordered an IV that needs to be inserted. Is that okay?
Yes.
Okay. So I'm going to place you in a comfortable position. Is there anything you need before we begin?
No.
I have my linen saver pad underneath. I'm gathering all my supplies and I'm checking the expiration dates on all of them and making sure everything is good to use. I'm first going to take my flush with my J-loop and connect them. Taking this off, I'm going to get the air bubble out. And then I'm going to push a little fluid through to make sure it goes all the way through, and it did. I'm keeping that in there. Now I'm placing the arm independent, and I'm going to open my IV start kit and get everything ready. Tourniquet, my alcohol. First, I'm going to put the tourniquet on. Once I do that, I'm making sure it's tight, and I'm going to feel where I'm going to be inserting the IV. And I'm going to do right there, so I'm going to undo the tourniquet. I'm going to do my hand sanitizer and put gloves on. I will take my alcohol wipe, and I'm going to clean for 30 seconds. And I'm going to put this there so I know where I went. I'm going to get my catheter ready. I am using a 20 gauge today. I'm going to re-put on my catheter. I let the alcohol dry. I'm making sure not to touch the clean site. Okay, my tourniquet's back on. And I'm going to grab my IV catheter. I'm going to take the needle, and I'm just going to inspect my catheter and my bevel to make sure everything's intact. And I'm going to go bevel up. I'm going to go in at a 30 to 45 degree angle. I'm going to use my non-dominant hand to pull back the skin, and I'm using my dominant hand to insert the IV. And I'm going to let the patient know there's going to be a little bit of a poke, and here we go. So once I see my blood flash, I'm going to drop it about a half a centimeter, and I'm going to stabilize and start inserting my catheter. Once I hear my catheter click, I'm going to take my tourniquet off. I'm going to make sure to stabilize my catheter and take this off. And I'm going to take my J-loop and insert it. Once that is inserted, I'm still holding pressure, making sure to keep it stable, and it's flushing. I'm flushing 3 to 10. I'm going to get that out of the way. Now I'm going to take my Tegaderm and I'm going to apply that here. I'm going to make sure I keep the pink part. Covered. I would tape it, and I would make sure to do it so that I can do the tubing if needed. I'm going to tape this together, and I would make sure to put my needle right into the sharps container. I'm going to clean up all my supplies, and is there anything else I can do for you?
No, thank you.
Thank you.